Social Democrats, Catherine Murphy.
Thank you. Taoiseach, the UK variant is now the dominant virus, and we can see just how difficult it is to get the numbers down. Yesterday, there were over 1,000 positive cases 6 weeks after the level 5 restrictions were imposed, with a further 6 weeks level 5 all but announced. There were just under 1,000 people in hospital, with the numbers in ICU remaining in the low 200s yesterday, and sadly we're still hearing of high numbers of deaths. The RTE primetime programme from Tallaght Hospital earlier this week was a reminder of the huge physical and emotional cost on our healthcare workers, which is clearly totally unfair and utterly unsustainable. While the positive numbers have fallen from the shocking peak in mid-January, suppressing the virus is going to be really difficult. All the more reason why we cannot risk importing new variants that could be vaccine resistant. I raised the issue of international travel with you 3 weeks ago, and I asked about quarantine. You said it would be disproportionate and unworkable. You also told me that the majority of people travelling were doing so for essential purposes, which is clearly not the case. I wonder, where did you get that information? Government has since announced that it does intend to introduce quarantine, and also you have introduced some additional measures. But the practical aspects of quarantine lag far behind the announcement. The expectation was that we would be all in here passing legislation that was needed, and that there would have been some forward planning for worst case scenarios, which obviously hasn't happened. Taoiseach, test, trace and isolate are key parts of our strategy and in the suppression of the virus, but you yourself have said that it's impossible when the numbers get very high to effectively use that as a strategy. We can see there are 2 ways of dealing with this virus until the vaccine gives us protection. One is to go for a near zero suppression with aggressive test, trace and isolate, together with strict measures in place to prevent further variants arriving into the country. But such measures have to be workable. They can't be self-governing. The other is rolling lockdowns with all the damage that they bring. There's no easy solution to this. There's damage no matter what. It's a question of limiting that damage. But it seems that we have a bit of both. We're hearing that the Living with COVID plan is due to be updated. What do you mean by living with COVID? Instead of dates, can you state what that looks like in numbers? Is it near zero? Is it in low hundreds? And we can see when it is low hundreds how quickly that can escalate. The day the UK flights were halted in December, there were 484 cases, 200 people in the hospital and 31 in ICU. And we've seen what happened since.
Thank you,
My questions are, if there is to be a further 6-week lockdown, what is the aim in terms of numbers? Has that been modelled? And is it known what activities are most dominant in terms of the spread of the virus? The public need specific rather than general information.
Thank you, Deputy.
Thanks. Thanks very much for your question, Deputy. Just to clarify, and I have clarified this before, when I used the term disproportionate, what I was referring to was the fact that it could be argued, and I think it will be argued, that it's disproportionate to impose mandatory hotel quarantine on people who don't have COVID, when we don't do that to people who do have COVID. At the moment, there are lots of people in the country who have tested positive for COVID. Unfortunately, none of them are in mandatory hotel quarantine, and that's where we may very well run into a very genuine legal issue around proportionality, because the vast majority of people travelling in from overseas don't have COVID. They have a test to say they don't, whereas we know that there are hundreds of people every day in Ireland already being tested positive for COVID, and we don't mandatorily quarantine them. Obviously, anything that could save hundreds of lives or thousands of lives is proportionate in my view. The disproportionality point is a different point, and perhaps is one that you'll hear about in the courts at some point in the future. Just in relation to cases, I think it's important to say that we have gone from a situation where we were seeing 6,000–7,000 cases a day to 1,000 or less a day now. So that is a very significant reduction in the caseload. The number of people in the hospital is now below 1,000, and the number of people in ICU is about 170. So while we have seen a very significant decrease from the peak of the third wave, these figures are still higher than the peak of the first wave, and we have a long way to go yet before we're in a position to ease restrictions substantially. We need to get down to much lower numbers than we have now. We haven't agreed an exact number. I know why you'd like that. It was something that I would have liked in the past, but the advice that we have from NPHET is very strong on this, that it is wrong to pick particular exact numbers, that you need to look at a number of things in the round. And it's not just the 5-day or 7-day case number average. It's not just the positivity rate. It's not just the number of people in ICU. It's not just the number of people in hospital. It's just not just the number of hospital beds available. You have to look at all of these things, and using one or two metrics they advise is too crude, and the government has accepted that advice. In terms of strategies, I don't think it's a choice between one or two strategies. There's a lot of slogans floating around. There are many different strategies and many different sub-strategies, and it's the detail that is important. And there really isn't any strategy, unfortunately, that avoids the risk of rolling lockdowns or snap lockdowns. We saw in Perth the other day 1 or 2 cases of community transmission led to a 5-day snap lockdown in Perth. In our context, with our geography, with the border, with people coming in the front of trucks and the back of trucks, if we applied the same policy here, we would probably have snap lockdowns every week or every 2 weeks or every 3 weeks. So we have to bear that in mind, that our geography does affect us. In terms of living with COVID, what that means is suppression. It means reducing numbers as low as we can, so that we can open society, so that we can open the economy in a way that is sustainable. Yes, there is modelling done on this, but no, we haven't picked any exact numbers. NPHET advised that for reasons I explained.
When the word disproportionate was used, Taoiseach, the way the public hear that is it's okay for people to go on holidays, but they can't send their kids to school. That's the way it's heard. And it's important that there's an understanding of of just exactly how the public are hearing some of this. And indeed, a further 6 weeks lockdown has all but been announced. It came from leaks from 2 parliamentary party meetings, and that needs to be managed way differently. And it's not fair that the public hear in that particular way. The public need to have an expectation of just exactly what are the milestones in relation to reducing this virus and what might be opened in terms of schools. Or, if we are going to open a lot more, we can only do that by getting it right down.
Thank you, Deputy.
And I think we've got to be straight with people on that.
We're over time. Thank you, Taoiseach.
Thanks, Deputy. As I'm sure you'll agree and you'll appreciate, the way things are heard isn't always what was said or what was meant, and that's even without being misrepresented. Something you say or mean can be heard in a different way, but I'm happy to once again clarify that. Anything that will save hundreds or thousands of lives is proportionate in my view, but we may run into a legal issue around proportionality, which I've explained to you now, so that may arise. I agree with your question and your comment. We need to get numbers down very low, as low as possible, before we can safely reopen our society and our economy again. And I believe that's what all of us want in this House. There's little point in reopening things that you then have to close 3 weeks later. And that's why we need to get numbers down as low as we possibly can. We just don't know exactly what that is currently in the current context. In relation to international travel, the government, as you know, has already introduced PCR testing. Did that in January. We've already introduced mandatory home quarantine. Did that a few weeks ago, and we will be extending the number of countries that are included on the Category 2 list.
Thank you,
countries for which mandatory hotel quarantine is
Taoiseach.
required, and they are 18 countries, 16 in sub-Saharan Africa, Austria, and the United Emirates, being added to Brazil and South Africa.